Governor J.B. Pritzker ripped the White House for its lackluster response as states like his combat the growing spread of coronavirus. Illinois Governor J.B. Pritzker said Monday that the 300,000 masks sent by the federal government were not the type of masks the state needs to properly combat the coronavirus. The Democratic governor appeared at his daily briefing alongside Chicago Mayor Lori Lightfoot and said the state has purchased more than 5 million N95 masks and more than 5 million surgical masks, which will be arriving by the end of the week. Pritzker said he had asked the federal government to help Illinois by providing personal protective equipment, PPE, like N95 masks, but that the White House instead sent 300,000 surgical masks. I can say with certainty that what they sent were not the N95 masks that were promised, but were surgical masks, which were not what we asked for, Pritzker said. In our first request to the federal government, we asked for 1.2 million N95 masks. That was weeks and weeks ago. We received a fraction of what we asked for. Pritzker has been outspoken in his criticism of what he calls the federal government's profound failing in handling the pandemic, as well as Trump's repeated questioning of whether states really do need more equipment and assistance at the federal level. I can't emphasize enough how much we need the federal government to step up and amplify the size of their PPE deliveries to Illinois, and frankly, across the nation, Pritzker said on Monday. On Friday, Pritzker implored the president to invoke the Defense Production Act to put order into the market for ventilators and PPE and allow states on the front lines to access the equipment we need. The 1950 law gives the president legal power over industrial production. Trump invoked the law on Friday, ordering General Motors to produce the ventilators that hospitals desperately need. He needed to do this weeks ago or even yesterday, but it will still make a massive difference in our national healthcare system if he moves quickly, Pritzker tweeted. One way or another, we need these supplies. And I have a whole team of people whose singular focus right now is working the phones across the world to get as much PPE, as many ventilators, and as many tests as possible shipped to Illinois. On Saturday, Pritzker thanked businesses and individuals for donating their own supplies and equipment to make up for the lack of federal help. Each mask, or gown, or set of gloves will make a difference for one of our frontline workers, and all of our donors should be proud of their part, the governor said. The governor also said in his briefing on Monday that the McCormick Place Convention Center in Chicago will be turned into a field hospital with 3,000 beds, 500 of which are expected to be ready for use by the end of this week. Illinois Department of Public Health Director Drive Goziazai confirmed at the briefing that the state had suffered 8 coronavirus-related deaths in the past 24 hours. One person died while incarcerated at Stateville Correctional Center. The numbers put Illinois coronavirus death toll at 73. Lightfoot said that the number of confirmed COVID-19 cases in Chicago is doubling about every 3 to 4 days, with the number of confirmed cases in Illinois currently at 5,057. More than 460 of those cases came in the last 24 hours. A global pandemic is not an excuse to attack essential, time-sensitive medical procedures like abortion, said Alexis McGill Johnson, acting president of Planned Parenthood. State officials in Iowa and Ohio were hit with lawsuits on Monday over their decisions to ban abortion during the coronavirus outbreak. Both states recently deemed abortion a non-essential surgical procedure that must be deferred or canceled in order to preserve medical supplies for the pandemic. Planned Parenthood Federation of America and the American Civil Liberties Union of Iowa and Ohio are asking district courts to immediately restore abortion access, arguing that it's an essential, time-sensitive procedure that has been improperly categorized as elective. A growing number of states largely governed by Republicans are using the coronavirus outbreak to crack down on abortion. In addition to Ohio and Iowa, Texas and Mississippi have ordered health care facilities to stop providing abortions. Patients presenting for time-sensitive care, including abortion care, need timely access to treatment, even during this pandemic, said Catherine Ragsdale, an Episcopal priest and president and CEO of the National Abortion Federation, in a statement. Women deserve better than a craven exploitation of a healthcare crisis in furtherance of an anti-abortion agenda. Leading medical experts, such as the American College of Obstetricians and Gynecologists and the American Board of Obstetrics and Gynecology, have urged state leaders to classify abortion as a time-sensitive, essential medical procedure that cannot be delayed. Iowa Governor Kim Reynolds, R., halted elective, non-essential surgeries, including surgical abortions, in an emergency proclamation issued last week. The lawsuit against Reynolds, filed by Planned Parenthood and the ACLU of Iowa, asks the court to block the proclamation as it applies to abortions. In Ohio, Attorney General Dave Yost issued letters to at least 3 abortion clinics on March 20, ordering them to stop providing abortion care. The lawsuit against Yost, filed by abortion providers, the national and state branches of the ACLU and Planned Parenthood, calls for a temporary restraining order to stop the restriction from taking effect. Plaintiffs' patients would be denied their right to access safe and legal pre-viability abortion, in violation of nearly 5 decades of Supreme Court precedent that categorically prohibits states from banning abortion before viability, and is, therefore, unconstitutional, the lawsuit says. Some of these patients will be forced to carry pregnancies to term against their will and at risk to their health amidst a health system overburdened by responding to COVID-19, the disease caused by the coronavirus. An emergency lawsuit was filed in federal court last week to overturn a similar ban in Texas, where women are currently unable to access abortions at all. HuffPost spoke to one patient who was forced to drive 24 hours and cross multiple states to receive an abortion. A global pandemic is not an excuse to attack essential, time-sensitive medical procedures like abortion, said Alexis McGill Johnson, acting president and CEO of Planned Parenthood, in a statement. Anti-abortion politicians have gone too far.